Hi Shannon, this is my individual midterm project. I chose the medical specialty of cardiology and I'm going to be prescribing the top 10 most prescribed medications for cardiovascular disease. When I go through my medications, I'm going to begin with number 1, so the very most top prescribed, and work my way down through the rest of the 10. And I want to just go over a couple things as I go through. So for contraindications of each medication, you should always take into consideration whether or not the patient has an allergic reaction or a prior existing sensitivity to the medication. As well, there are certain drug interactions that need to be accounted for. For each medication, there was a long list of medications that should be cautioned or aware of, so whether or not you can mix the two prescriptions, if the dosages would need to be adjusted, or if the scheduling of when you take these medications needed to be adjusted. And there are also diseases and conditions that may contraindicate you taking a medication, and I will mention those when I go through. As well, smoking and alcohol can affect how or if you should take the medication. When I go through side effects, I'm going to start with the most common side effects, then make my way to less common, and then rare or most severe side effects, and I'll keep it in that flow for all of the medications. As well, when I talk about dosing, I'm referencing the average dosage for an adult patient. And for each patient, the dosage will vary, and that's for any type of medication. It varies by your body composition, your weight, your height, what other medications you're taking at the time, any pre-existing diseases or conditions, and as well, each medication should be taken as directed by your physician. Alright, so number 1 is metoprolol succinate. It is also known as Toprol XL for the brand name. It's prescribed. It is a beta blocker used to treat hypertension, angina, heart failure, and some contraindications could be hypotension, bradycardia, heart block, and alcohol use. Some symptoms or side effects could be blurred vision, chest pain, bloating, cough, blue fingers or toes, and chills. The different routes of administration would be oral, injection, or intravenous, and they come in capsules, extended release capsules, tablets, extended release tablets, and solutions. The dosage would vary by which condition we're using the medication to treat. So if you're using the medication to treat heart failure, it could be an average of 25 milligrams once daily for 2 weeks and then reassessing, or you could start at 12.5 milligrams per day and reassess again after 2 weeks, or however the doctor decides is best. And for angina, it could be about 100 milligrams per day. Hypertension could vary anywhere from 25 to 100 milligrams per day, and regardless, the maximum dosage per day should be 400 milligrams for the average adult. And it did say in my studies that you can gradually decrease that dosage depending on how it's working, how much you need it, or why you're taking it. The second medication is atorvastatin calcium, also known as Lipitor. It is prescribed. It is a statin used to lower cholesterol and triglyceride levels. Contraindications can be liver disease, pregnancy, lactation, or grapefruit juice. And some side effects could be headache, hoarseness, back pain, excessive belching or gas, chest tightness, or cough. And the route of administration would be oral. There are tablets or liquids. The average dosage would be 10 to 20 milligrams once daily. Some may even start at 40 milligrams daily. Like I said, it would be different for each patient, and your physician will assess what he thinks is best for you, and it may take a little while to figure out which dose is ideal. The maximum dose for that is going to be 80 milligrams per day. Third is Eliquis, apixaban. It is prescribed, it's an anticoagulant, it's used to prevent stroke, deep vein thrombosis, or pulmonary embolism resulting from surgery, or to reduce the risk of reoccurrence. So sometimes these medications are prescribed after surgeries to prevent blood clots from forming, or if someone has already had deep vein thrombosis or pulmonary embolism, it is used to reduce the risk of these blood clots. Some contraindications to taking Eliquis would be pregnancy, lactation, kidney disease, and grapefruit juice. It can have side effects of more easily bruising, nosebleeds, bleeding gums, anemia, dizziness, or severe bleeding, which would be a severe side effect. Any severe side effects, of course, or any side effects that you're concerned about, go straight to your doctor. They should let you know before you start taking the medications what to expect and what to look out for. The different routes of administration would be tablets and powder or tablet suspensions. These would be by mouth. The average dosage will be 2.5 milligrams twice daily for a prescribed number of days. So some of them are 2 weeks, 30 days, 45 days. It depends on why we're taking it, what surgery we had maybe, and what the physician thinks is best. Next is amlodipine benzoate, or Norvasc. It is prescribed. It's a calcium channel blocker used to treat hypertension, angina, and some arrhythmias. Some contraindications would be heart failure, liver disease, and grapefruit juice. Some side effects would be swelling of the feet and ankles, chest tightness, dyspnea, tarry stool, or bleeding gums. And the route of administration would be oral. There are tablets or solutions or suspensions. And the average adult dosage would be 5 to 10 milligrams per day with a maximum of 10 milligrams per day. Next is carvedilol, or Coreg. It is prescribed. It's a beta blocker used to treat hypertension or heart failure. Some contraindications would be severe hypertension, asthma, and heart blockage. Some contraindications could be a pre-existing allergy, angina, ankle, knee, toe, or toe pain, anxiety, bradycardia, and dyspnea. The route of administration would be by mouth. There are tablets or extended release capsules. And the average dosage is 10 to 20 milligrams per day with a maximum of 80 milligrams per day. Rosuvastatin calcium, or Crestor, is prescribed. It is a statin used to treat hyperlipidemia, and some contraindications would be liver disease, pregnancy, or lactation. And some side effects could be difficulty moving, joint pain, blurred vision, angina, dark urine, or fever. The route of administration would be by mouth. There are tablets or capsules, and the average dosage would be 5 to 40 milligrams daily. Sorry about that. My son woke up, so I just had to take a quick pause. I have 4 medications left. The first is losartan potassium, or Cozar. It is a prescribed angiotensin II receptor blocker. It's used to treat hypertension, diabetic neuropathy, proteinuria, and congestive heart failure. Some contraindications could be pregnancy, electrolyte imbalance, especially concerning potassium, diuretics, or NSAIDs. And some side effects could be body aches, chills, blurred vision, a tingling sensation, hyperkalemia, or jaundice. The route of administration is oral. There are tablets or solution. The average dosage would be 50 milligrams daily with a maximum of 100 milligrams daily. Lisinopril, or Prinvel, is a prescribed ACE inhibitor used to treat hypertension. Some contraindications would be a history of angioedema, renal failure, or hyperkalemia. Some side effects could be blurred vision, cloudy urine, abdominal pain, body aches, and arm, back, or jaw pain, as well as angina. The route of administration is oral. There are tablets or solution, and the average dosage would be 10 milligrams daily with a maximum of 40 milligrams daily. Metoprolol tartrate or Lopressor is a prescribed beta blocker used to treat hypertension, congestive heart failure, post-myocardial infarction, diabetic neuropathy, and contraindications would be bradycardia, heart block, heart failure, or alcohol use. Some side effects could be dizziness, fatigue, decreased urine output, dyspnea, or edema in the feet and ankles, as well as jaundice. There are extended release capsules, there's tablets, extended release tablets, or solution with a route of administration of oral injection or IV. And the average dosage would be 25 to 100 milligrams daily. Lastly would be furosemide, which is also known as Lasix. It is a prescribed diuretic used to manage edema associated with congestive heart failure, cirrhosis, renal disease, pulmonary edema, or hypertension. Some contraindications would be anuria, severely dehydrated patients as well, and side effects would include increased urination, dizziness, electrolyte imbalance, headache, chest pain, or chills. The route of administration is oral, injection, or IV, and these are supplied in tablets or solutions. The average dosage is 20 to 80 milligrams daily with a maximum of 600 milligrams daily. And to list my sources, so I used a website that says Definitive Healthcare tracks more than 3,800 cardiovascular drugs as of March 2024. So it's a year, almost 2 years old, but it seemed the most accurate and up to date. It ranked the top 10 drugs, which I explained, and then I went on and researched them. I also used the Mayo Clinic to search each drug, and I mostly use that website for the side effects and contraindications as well as dosage, and I used pdr.net for the brand name, drug class, and route of administration. I'm going to list all of my sources in the comments. I do have one more website that I used. I didn't necessarily quote it, but I just used it to research the drugs and understand them more, so I do have that listed in my sources as well.